Okay, we'll ask everyone to get seated so we can get our seminar started for today. So today we are joined by Darsh Tripathi, who is a master's student right now in Dr. Herzog's lab. He did his undergraduate degree here at the University of Calgary in biological sciences, and some of the research and projects he worked on were related to skeletal muscle and titin immunoglobulin domain refolding for passive lengthening and shortening. And currently, the interests in his master's thesis are related to osteoarthritis and diet-induced obesity models. One of the reasons that he wanted to pursue this type of research was because he sustained multiligamentous knee injuries and he might get OA someday. That's what he wrote on here, at least. And he hopes to pursue medicine in the future and contribute to the field of medicine through research as well. So we're looking forward to your talk today, Darsh. Thank you.
It's on? Yeah. All right. Thank you for the introduction, Jackie, and thank you everyone for being here. So the title of my presentation today is, does inherent aerobic capacity protect the knee joint from degeneration in a diet-induced preclinical model? All right, diet-induced obesity preclinical model. Let's get started right away. So osteoarthritis is a widely prevalent whole joint disease, and it is estimated that over 240 million individuals either report symptomatic or activity limiting OA. Now, OA primarily presents itself in significant joint structures such as the hand, back, knee, and shoulder, as we can see here. And it is often characterized by cartilage degradation, which we could see in this image right over here. Literature also shows that osteoarthritis is very closely linked to obesity. And that brings me to my next topic, obesity. So obesity is identified as a global health epidemic, and it is a key component within the criteria that defines metabolic syndrome. Other criteria within metabolic syndrome include insulin resistance, hypertension, and dyslipidemia. As we can see in this image, amongst other things, obesity also it leads to weakened muscle and bones, and it leads to joint pain. Now, previously, the incidence of obesity and osteoarthritis was believed to be purely mechanical. What do I mean by that? Well, if you're obese, you have an increased body mass, and that increased body mass results in a heightened or increased joint loading, which then leads to OA. However, obesity is also a risk factor in non-weight-bearing joints, such as hand and wrist osteoarthritis. All right, if they're non-weight-bearing joints, then it can't just be purely mechanical. So researchers came to this idea that maybe there's some metabolic pathways at play, and they labeled this as metabolic OA. Now, in order to kind of assess metabolic OA, researchers set out and created this diet-induced obesity model. And in this diet-induced obesity model, they used Sprague Dawley rats, and they fed them either a high-fat, high-sucrose diet, which is what we love, typical of a Western diet, and they fed the rest a chow diet, which is kind of representing a normal, balanced diet. Using these two diets, they assessed several things, including DEXA analysis. They assessed the joint integrity, muscle analysis, and also serum cytokine analysis. In the upcoming slides, I'll be showing you the results, what they found. Starting off with the DEXA analysis, we could clearly see here that a high-fat, high-sucrose diet caused an increase in body mass and body fat. We can see in the graph that the rats fed the high-fat, high-sucrose diet had a significantly higher body fat percentage and a significantly higher body mass. If we move on and look at other markers of metabolic syndrome, such as insulin sensitivity, total cholesterol, and triglycerides, the results indicated that a high-fat, high-sucrose diet induced local and systemic inflammation. You can see here that the rats fed the high-fat sucrose diet had decreased insulin resistance, and they also had increased total cholesterol and increased triglycerides. Further evidence of this systemic and local inflammation is seen from the cytokine analysis, where we can clearly see that majority of the cytokines and adipokines are significantly increased in the high-fat, high-sucrose fed group. Now, if we move on to the joint results, which I love seeing all the time, we can clearly see that in the rats fed the high fat, high sucrose diet, it's not pretty. All right. You can see in the chow group, very pretty, and you can see clear degradation or degeneration in the high fat, high sucrose group. So it was confirmed. Now, an interesting result came in the muscle analysis. So here we have intramuscular fat infiltration between two muscles. We have soleus on your left and vastus lateralis on the right. So soleus is a type 1 fiber, meaning that it's slow twitch and it has a high aerobic capacity. Vastus lateralis is a type 2 fiber and it has a low aerobic capacity. So the results indicate that fibers with a low aerobic capacity, or the vastus lateralis, were affected in terms of intramuscular fat infiltration, whereas the muscles with the high aerobic capacity were unaffected. All right. Keeping these results in mind, it led to researchers thinking, can aerobic exercise prevent metabolic OA? If we're seeing, aerobic being good, can aerobic exercise be somewhat preventful? So then they did a study to see whether aerobic exercise can prevent metabolic OA. And in terms of markers of metabolic syndrome, most of the parameters, as some of them are listed here, were the same for the chow group and the high fat, high sucrose plus exercise group. So in red, we have the markers of metabolic syndrome for the high fat sucrose plus exercise regimen group. And beside it, we have just the high fat group and then just the chow group. In terms of knee joint integrity, you can see here that the histological image over here of the knee joint for the high fat, high sucrose group plus the exercise regimen shows that it was actually, in fact, protected when you compare it to just the rats that were just fed the high fat sucrose group. So in a short answer, can exercise prevent metabolic OA? Well, that's what they saw. So keeping these results in mind from the diet-induced obesity model, this result of the exercise being, preventing the metabolic response, the different metabolic responses and the different fiber types, it led to this idea about aerobic capacity. And literature shows that animals with an intrinsic high aerobic capacity are less affected metabolically. So sorry, the mic fell off. Now, because of that literature, we got to thinking that what if aerobic capacity may not only protect against metabolic disease, but what if that inherent aerobic capacity also protects the musculoskeletal system? And for our case, in the presence of obesity. Now, what is aerobic capacity? We've been throwing that word around, but what is it? So aerobic capacity is multifactorial, it's polygenic in origin, and it is influenced by lots of factors, and one of them is the environmental factors. Now, based on our idea, we would need to achieve a model for this aerobic capacity, right? How do we achieve that model? We do that through selective breeding. Now, can we do this in humans? Can we do selective breeding in humans? Can we choose the best performing male? No, we cannot. We cannot do that in humans, so we have to do that in rats, all right? In 1996, our collaborator, Dr. Lauren Kaw, she developed these two lines of selective outbred rats, all right? And she used Sprague Dolly rats as her founder population, and she made them run this endurance test. As you can see in the schematic here, the endurance test was basically the rats, they were run on an incline of 15 degrees on a treadmill until exhaustion. After the endurance test, what they did is they took the highest performing male, they took the highest performing female, and they bred them. They took the lowest performing male, lowest performing female, and they paired them for mating as well. They did this for 3 generations. And after 3 generations, they saw a difference of 70% in performance. All right. So this difference kind of encouraged them to keep proceeding with the selective outbreeding. And they actually, the following year, Dr. Kaw, she launched this large-scale artificial selection study where she selected for aerobic capacity, only this time she used NNIH rats instead of Sprague Dolly rats. So NNIH, the NIH stands for National Institute of Health. The NIH rats are a mix of 8 different strains. All right. Now, if it's a mix of 8 different strains, that means they're more genetically heterogeneous. And if they're more genetically heterogeneous, that allows for more genetic variance, which in turn allows for better selective breeding. So they did the same thing. They did the same endurance test. All right. They paired the highest performing male, highest performing female, lowest performing male, lowest performing female. And they developed these 2 lines or strains called the high capacity runner rats and the low capacity runner rats. Now with the Sprague dollies, we saw 70%. Well, after 6 generations using the NIH rats, they saw a difference of 171%. After 11 generations, 347%. And after 28 generations, 800% difference in performance. So this huge difference in performance is all good, but it kind of encouraged researchers to see whether these rats would serve as a model to, more so assess disease risk. So what they did is that they conducted a bunch of studies, and what they found was that animals with this intrinsic high aerobic capacity, or the high capacity runners, they were less affected metabolically. So essentially, they had lower weight gain when exposed to the high fat, high sucrose diet. They had less metabolic complications. They had a reduced incidence of insulin resistance, decreased risk of diabetes, and also a decreased risk of cardiovascular diseases compared to the low capacity runners. However, whether these findings in metabolic response also translate to either partial or full protection from degeneration in the musculoskeletal system has never been investigated with these rats. So that brings me to the purpose of my study, where I will be assessing the impact of a high fat, high sucrose diet on the knee joints in these high capacity runner and low capacity runner rats. We hypothesize that the high intrinsic aerobic capacity in these high capacity runner rats will have a protective effect in OA-related damage in the knee joints. Moving on to the methods, we had 36 NIH strain, 25-week-old male rats. And you could see here that they were from the 49th generation. We had 18 high capacity, 18 low capacity, and they were randomized into the diet groups as seen in the schematic below. I also have a little breakdown of the diet and below. And then each of these groups, they were fed the diet for 12 weeks. And during these 12 weeks, we did many things. We conducted oral glucose tolerance tests and blood collections at weeks 0, 6, and 12. We conducted DEXA scans, feces collections, and tracked food intake at weeks 0, 3, 6, 9, and 12. And we also did body mass tracking every week. After the 12-week diet intervention period, the rats were sacrificed. And I'm going to talk a little bit about my primary outcomes next. So in terms of primary outcome, as you know from the title and the hypothesis, is knee joint integrity. Now, mainly, I will be assessing knee joint integrity using histological analysis. So this means I'll obtain 10 micron knee joint sections using a microtome. These 10 micron sections will be stained and quantified using a modified Mencken scoring. I will also be assessing knee joint integrity via micro CT imaging. And the parameters that I'll be quantifying will be trabecular thickness and number, bone mineral density, and cortical thickness of the tibial epiphysis. In terms of secondary outcomes, I'll be looking at body composition, gut microbiota, and also markers of metabolic syndrome. Today, I'll be sharing some preliminary results with you guys, starting off with the knee joint result. So here I'll show you an image of the low capacity runner rats on the chow diet. So here it is. You can see we have some degeneration going on. And if we zoom in, we see that there are these cysts forming in the femoral cartilage. And these cysts are starting to break the cartilage. It's an indication of degeneration. We can also see on the tibial surface, cysts are beginning to form, and there's some fibrillation going on. If we look at the low capacity runner rats fed the high fat, high sucrose group, we see similar degeneration, if not worse. We see these bigger cysts forming, starting to break the surface on both the femoral and the tibial surfaces in the cartilage. And we also see some fibrillation starting to happen as well. Now, the result that everyone's been waiting for, how does the knee joint look like in these high capacity runner rats? Were they protected or is it bad? Well, you tell me. It looks pretty clean to the visual eye. We don't see these cysts forming. We do not see these fibrillation happening. It's pretty much protected, or partially protected, we could say, compared to the low capacity runner rats. Now, if we take a look at the modified Mencken scores, here I have a graph in front of you that shows the difference between the low capacity runner and high capacity runner rats based on each diet. The modified Mencken scores show a significant difference between the low capacity runner and high capacity runner strains, regardless of the diet. Regardless of the diet, the low capacity runner rats had increased modified Mencken scores. Now, this result suggests that this inherent high aerobic capacity has a protective effect against metabolically induced degeneration of the knee joint. So we made sure, okay, there's an effect of the strain. The strain, we're clearly protected in the high capacity strain. How about the effect of the diet? Well, if we look at this graph, we don't really see a difference between the two diets within each strain. All right. But if we take a closer look in the low capacity runner group, all right, we see that 5 of the values in the low capacity runner high fat, high sucrose group, so 5 values are above the median of the control group. So we can see here that 5 values are above the median for the control group. This to me suggests that there's a trend going on. If we have 5 values above the median of the control group in the high fat group, possibly there might be a trend if we add more rats. Well, I said these are preliminary results. And to tell you the truth, we still have 4 more rats to add to the high fat group for the low capacity runner. And we have 1 more rat to add to the low capacity chow group. So perhaps we may see a significant difference between diet within the low capacity runner strain. Now, here's a quick summary, kind of a bird's eye view of all 4, where we clearly saw the effect of the strain, but there's still that little confusion or doubt whether the diet really worked. Did the diet really work? How do we know if it worked? Well, in order to see whether the diet worked or not, I want to present the graph for the body fat. Now, if we look at this graph, animals fed a high fat, high sucrose diet had a significantly increased body fat content, whether that be the high capacity runner rat or a low capacity runner rat. Regardless of the strain, if they ate the high fat, high sucrose diet, they had an increased body fat. I also want to kind of point out that the low capacity runner rats here in the black square exhibited slightly higher mean body fat percentage compared to the high capacity runner rats on the high fat, high sucrose diet. Now, this may suggest that there are potential variations in the group regarding metabolic variations. However, it is not significant. Now, if we think, what do the results mean? Let's summarize the results first. So we saw that both groups subjected to the high fat, high sucrose diet had an increased fat content. We saw that the low capacity runner rats had significantly increased modified Mencken scores compared to the high capacity runner rats. And then we also saw that there was no significant difference observed in the scores between the 2 diets within each strain. Now, I said this is still preliminary, so yet we don't see a difference. However, this is still an interesting result to me because this suggests that while diet composition may affect body fat content, it may not have a significant direct impact on joint health and joint integrity, at least within the context of this study and the parameters measured. Now, going back to the beginning, can these rats be used as a model to assess musculoskeletal degeneration? Well, we have some promising results from the knee joints, all right? I do want to show you some muscle fat infiltration analysis from these rats that have been done in the biceps muscle. So if we take a close look at this graph, it's showing the fat infiltration in the muscle between the low capacity runner rats and the high capacity runner rats. Here we see significant differences everywhere. We see that the low capacity run, there's a significant difference between low capacity runner and high capacity runner for both diets. But we also see a significant increase in the low capacity runner strain between the two diets. So the low capacity rats fed the high fat, high sucrose diet had significantly more intramuscular fat infiltration compared to the low capacity runner rats fed the chow diet. We see the same in the high capacity runner rats, where the high capacity runner rats fed the high fat diet in red, had significantly higher intramuscular fat infiltration compared to the chow counterpart. But what's interesting here is we may see a trend. We see that even though the high capacity runner rats fed the high fat, high sucrose diet show this increased fat infiltration, it still seems less when we look at the low capacity runner rats. So it shows a promising trend. So based on the promising knee results, promising muscle analysis results, we still need to do further analysis to confirm whether it could be used as a model. And these further analyses include micro CT analysis, which will be happening, cytokine array analysis, which will be happening, and lipid profiling, which will be happening. And also Mauricio over here, who will be quantifying everything in the muscles as well. So I'd like to end with the significance of the study. So it is established that obesity and associated metabolic syndrome are risk factors for joint, bone, and muscle degeneration. And these unique metabolic profiles in the high capacity runner and low capacity runner strains might point to crucial metabolic factors responsible for this metabolically induced degeneration that we talked about. Furthermore, this preclinical research might be readily translated to clinical trials in patients suffering from obesity and knee OA, and provide mechanistic insights into pathways regarding obesity and OA. And also, it can provide insight into treatment modalities through aerobic capacity training. With that, I would like to thank everyone for listening, and these are my acknowledgements. Happy to take questions.
Awesome. Thanks, Darsh. Does anybody have any questions to start us off? Yeah, Michael.
Sure. Thanks, Darsh. Nice presentation. My first question, so in that last one, you showed the body fat percentage, and in these, both the animals, whether they're low capacity, high capacity, but both fed the high fat, high sucrose diet, they kind of lie close to each other.
Yeah.
So if the overall body fat percentage is similar, yet they have different, do they have different distributions of fat then? So their fat is stored in different locations between the two groups?
That is not something I know off the top of my head, but I think we may be able to kind of look into that, whether quantifying whether the subcutaneous fat is higher or the visceral fat is higher, but we have not really done we haven't looked into whether fat is stored differently between the two strains, but it would be very interesting to see for sure.
Thanks, Darsh. So I don't know a lot about the breeding and this line of rats, but so the more generations you have, do you think that it changes the applicability of the model to humans? So I know your results are preliminary right now, but provided they hold true, for instance, do you think you'd see the same finding if we had like maybe a second or third generation, which may better align with human breeding?
100%. So I would say, to kind of answer that, it's obvious we cannot go back to the third generation, right? We're past that. So I think maybe an interesting study would be to get the 50th generation, let's say. We have the high capacity runner and low capacity runner. And what if we just use the low capacity runner and we aerobically train them? So we try to increase their aerobic capacity, which would be which we can do in humans. And if we see a difference, if we see that even in the low capacity runner rats, when they're aerobically trained, we see this protective effect, then I think it would be translated to more of a human. Because yeah, these are superhumans, and it's not, you know, like elite to like couch potatoes. So yeah.
Just to kind of follow up on that question, and maybe this is like kind of more exercise physiology people, but if you were to measure like the lowest capacity humans versus like elite marathon runners, what is, and you said there was like an 800% difference between the
Yeah, for
high and
ours,
low.
it was like over 1,000, I think.
So what is the difference that you would expect in the human population, or like maximum difference?
That's, you know, I'm not really sure how drastically different they are, but I would still expect a hefty difference, to be honest. But to give you a number, I would be definitely lying to if I gave you just a random number.
So let me give you an estimate here.
Yeah, he's a runner, so he knows.
Some people can run 100 kilometers straight,
Mhm.
and some people cannot run 2 meters.
Yeah.
So the difference probably means running per time or per distance would be more than an 800 %.
But I guess it would
Would
also
be
be,
my hunch.
it would also be different to like difficult to parse out inherent, like you'd almost need like twins of elite marathon runners who don't exercise or something, like
Yeah.
taking apart that. Yeah, right.
I seem to remember learning years and years ago, maybe as an undergraduate, about people that are just sort of inherently gifted with aerobic capacity. Like
Yeah.
that's been quantified, people that just have high VO2 maxes and they've never. Do you know what the prevalence of those type of people are in the population?
I think Walter always talks about this, that people in Africa, they just seem to be good at running sprints because they have more of these slow twitch fibers.
Yeah.
So I'm not really sure about the
That
prevalence.
could be genetic, right? Like I think there's people that you could just pop off the street from Strathcona or whatever, and like they're just gonna have a high VO2 max. And I don't know if the physiologists in the room have ever quantified that, but it makes me, I mean, I know they've they've estimated the prevalence of these people. And I just wonder how the prevalence of those people relates to the prevalence of OA.
I've not
There's a
looked
lot of
into
people who aren't gonna be considered
obese.
as having a high VO2 max. And then there's a lot of people that get OA. I was just curious about the prevalence of those types of people.
So let me make a non-scientific comment to that. If you want to be, an elite cross-country skier, they say you need to have a VO2 max of minimally 75 milliliters per kilogram minimum. And so in Canmore, population of about 12,000 people, you have multiple Olympic medal winners and World Cup winners and World Championship medal winners. So I assume they have more than 75%, so they're on the relatively high end of what you would expect from people. Of course, some of it is training, but you cannot just train. So here you have a population of 12,000 compared to what, about 8 billion. And there is a distinct number of people that must have an extremely high aerobic capacity. Or in other words, if everybody in Calgary would be cross-country skiing, Calgary is what, 1.5 million people, we probably would beat Norway in cross-country skiing at the Olympic Games if everybody trained, because there is people that naturally have that.
And possibly the environmental factors play a role in
The
that.
good question is, if we analyze people that have OA naturally, and we classify them based on their aerobic capacity, would there be a correlation? I don't think anybody has ever done that.
No, yeah, somebody should do that.
Next.
Nick, you don't want to do it?
No, next study, yeah.
I don't know if what about, wasn't there that study in the 90s that came out with all of these really elite marathoners and they had this really high OA prevalence, and that's kind of gone away? There's a few of these studies from this early 90s period where it was like, oh, running a lot is really bad. It kind of drove this idea. but then it's kind of like dropped off since then. You don't ever hear of, elite marathoners limping around after, 40 years of running. So I don't know what that says about, running or exercise in a way, but there's something there.
I'm going to press you on something you said in the very beginning, and you said the thumb joint is a non-weight bearing joint, therefore it cannot get OA for purely mechanical reasons.
Well,
Can you
I think I
explain
meant to
that to
say,
me?
I think I meant to say the hand and the wrist.
Okay.
So
Can you explain
typically,
why a non-weight bearing joint couldn't get OA for purely mechanical reasons?
well, I should have just said it can't be because of heightened joint loading.
Why?
Because unless you fall and get it,
Why?
how would you have increased joint loading in the?
Do you know what the force on if I pinch my thumb to my finger, what the force of my thumb joint is?
No.
It's 10 times the pinch force.
Interesting.
My point is that forces come from other places
Yeah.
besides gravity.
Never
So
thought of
I
that.
think that a hand could, my point is, I think my comment is, I think a hand could get OA
From
From
the
mechanical
mechanical
load.
loading, yeah,
in theory.
in there, yeah.
Thanks, Darsh. Hold the passion.
Sorry.
Hold the passion. I have a question in relation to the diet. So I think a lot of these kind of preclinical models, and there's an underlying assumption that high carb, high fat is bad in and of itself. But I think the type of fat is quite important, and the type of sugar as well, in terms of kind of whole body inflammatory response. Is like in these type of rodent models, is that ever considered? And you think kind of the distribution of that mono, poly, saturated, saturated fats could be playing a role as well?
100%. That's a great point. I think I'll just see if I could go back to the diet breakdown. I think it might just give you which sugars were used and which fats were used. No, it does not. But okay, total energy is sucrose, and I believe the fats, can't recall the top of my head, but they do provide us with which oils and what they use for the fats. But I haven't looked too much into the diet because the truth is they've been using this for many years, and it is shown to be effective in terms of a diet-induced obesity model. So that's why we've been using this. But I think you're definitely right. It would have an impact based on what type of fat you use and what type of sugar you use.
I'd be curious kind of like why they have an increase in body fat. Like, is it the sugar content that promotes an increase in volume of eating, and then the fat is leading to a surplus in caloric intake?
So I don't know if we definitely track that through food intake, and what we see is that pretty much the food intake is very similar. So you would like to think that if they're eating this high fat, high sucrose diet, they're going to eat more of it as well, and they do a little bit, but I don't think that's the primary cause of the increase in body fat just because they're eating more. I feel like the diet is altering these metabolic pathways, which is then causing an increase in body fat, if that makes sense.
I think just to be precise, over the past few studies, we seem to have found that they eat about the high fat sucrose animals and the chow animals eat about the same amount of food in terms of grams, but the high fat sucrose diet has more calories than in the chow, so they tend to eat more calories, but not more gram of food. That's what it seems to be.
The energy intake is higher.
Any other questions? Michael?
When you're doing the slicing of the knee joints, how do you choose the orientation of the two bones?
It's a great question. So it's dissected, and then we decalcify them and fix them in paraffin wax. Now, there are kind of two ways to determine the orientation. You can either cut the joint in half and lay them just flat like this, or you could keep the joint as whole. And how we fixed it is we have a little beaker, like not like a little, just a dish filled with wax that we'd fill wax, and we put the joint down like this, the patella down, and then the femur and the tibia, and then we put wax in it, and it's just embedded. So when we're cutting, we're really cutting at this view. Yeah.
So the angle of fixation of the knee joint is the same for all rabbits, or there's some small variance?
For all rats?
Or yeah. for all
Yeah.
rats.
Well, we try to make it the same, but of course, human error, it might tilt over a little bit or not. But I think we control it to be the same for all the joints, and we correct for that when we start cutting as well. If it's a little bit tilted, well, we correct for that using the microtome, the angle and everything.
Any more questions, please?
How much was the amount of fat in the biceps?
Just go back.
That slide is wrong. That is not fat. That's fibrosis.
This is fibrosis.
Yeah, so
Oh,
be
I'm so
very
sorry.
careful.
20%?
Is
Yeah, that's fibrosis.
20%, which is a lot.
Wrong label there. So the picker series.
Oh yeah, picro, yeah. The oral we don't have yet. So
Another question, so why would a slow muscle be protected from fat accumulation?
well, if we think about it, they have this high aerobic capacity, and they kind of, it's said that they readily utilize the free fatty acids. So I would assume because of that, they were protected.
But the amount of energy that you get from fat is much higher than what you get from carbohydrates. And they're not active. So if you say they're utilizing it, they're not
Mhm.
active, they're sitting in the cage.
That's a good question. Not too sure, Venus, why that would happen. I was under the assumption that because they readily utilize these free fatty acids, that's why we saw the result that we saw. I never thought of it that way. But I would have to look into that and furthermore.
So when they're standing, they don't have to be moving. As long as they're standing, the soleus is active to help stand.
Question in the back?
Darsh,
Yeah.
so you've got the high performance and low performance when they're in like an exercise environment, but does that translate to changes in their habitual behavior in a non treadmill based?
Yeah,
setting?
so we spent 15 weeks with them, and you can, even if you didn't know that there are these two strains, like let's say someone I bring from Strathcona from the street, they would be able to identify that these are different. You know, the high capacity runner rats are just constantly moving, very, very frigidity, and definitely much skinnier compared to the low capacity runner rats, which are a little bit bigger and they just don't move at all, kind of. So yeah, does that answer your question?
Yeah, how could that would that potentially play into some of the results that you see, sort of like the habitual loading of joints? Would that have some sort of beneficial characteristic for cartilage and bone potentially?
I think so. Here's the thing. Before so we got them from the US, and we got them when they were 25 weeks old. So they were not running constantly, I believe. That's right, Mara, right? They weren't running in the States.
They were never trained.
They were never trained, so they were never in a environment where they had a treadmill available.
Mhm.
So I think if they had a treadmill available to use when they were, there in the States, and then we got them here and we didn't put them in an environment treadmill, 100%, I think there would be a difference in the results. But because of that, I don't think it would have an impact. But
Other questions? Anyone in the back?
One last one.
Michael?
On those, can you go back to the histology slides, the high fat and sucrose group?
Yeah.
Um,
this one?
No, the one with this one.
Yeah.
So what's the difference? Like in this chow diet, you see it looks like it has a higher cell density in the articular cartilage and like the red,
Mhm,
at
it
its
does,
top
yeah.
levels compared to the high fat, high sucrose diet, right?
Yeah.
Is that true?
Yes,
That's what's going on.
So what we're seeing in these is we're seeing kind of a little bit like a little loss of proteoglycan, and we still need to further explore on how to quantify that. So as of now, I don't have an exact value of difference or not, but 100%, I think we see a difference we see this proteoglycan loss, especially in the femoral surface here. So
So do you think if you just let this run out for another 12 weeks, you'd end up with, similar joints as the low capacity runner rats?
it's an interesting question. I would want to say no, to be honest, but
I mean, because it looks
Well-
like you have one cyst there on the far right side of the image.
that's an artifact. It's not a cyst.
No? Okay.
It's an artifact from cutting. But I think at that, if 12 more weeks, then they would be 24 plus 12 plus 12, they'd be 48 weeks old. So the age would also impact.
Darsh, since you're on that slide, you talked about, loss of polyglycan. So talk a little bit about what you evaluate when you do the Mencken scoring.
Yeah.
Because a lot of people might have no idea what you're talking about.
For sure. So in terms of Mencken scoring, we kind of score every lesion. And so if we see a cyst, let's say over here, we score the lesion and we give it a grade based on like 0 to 6. And it just increases in severity as we go from 0 to 6. Like 6 would be multiple cysts breaking the surface of the cartilage, and 1 would just be one small cyst. So we kind of grade every lesion. Similar to the surface, we grade the cartilage surface based on whether we see erosion or fibrillation, or we see completely it's splitting the tide mark. So that's how we do the modified Mencken scoring. That's how we score it.
You talked about proteoglycan.
Yeah.
How do you evaluate that?
So in terms of proteoglycan loss, we haven't done too much yet. There's so much stuff to explore in the future, because with proteoglycan loss, I think the way in literature, the way they kind of quantified is, I think, using image J and using kind of a color threshold to see how much loss you have compared to how much there is. But I think that will be a further analysis moving forward.
Great. You looked at proteoglycan loss.
No,
And you did the scoring.
yeah, from our
How do you do
visual,
that?
just visually,
But how do
we
you do
compare.
that? What do you look at?
Oh, what we look at? Well, we look at the cartilage above the tide mark. So we have the
What do you look at?
we look at the cell density,
You look at
the staining. We look at
you
the
look
stain.
at the staining.
Yeah.
You look at the changes in staining.
Yeah.
Because when you have loss of proteoglycan.
It's a lighter
Exactly.
stain. Yeah. Yeah. Sorry. That's what
Let's be clear here.
Yeah.
And then just for everybody to understand, so when you have a higher Mencken score, what does that mean?
that indicates a more severe.
So the higher
Score, yeah.
score is more
Yeah.
severe.
100%.
How do your values from these high and low capacity runners compare to, like, I don't know if it's Kelsey stuff,
Calcium, yeah.
like in a Sprague Dolly rat?
Mhm.
And then would you get the same thing if you went back to one of the original NIH? Like, is that approximately the same as a Sprague Dolly rat?
Oh, if you're saying we use the,
Like, say if you went back to the original NIH.
which is what,
rats.
like the first one.
Yeah, first.
Oh,
before
just,
they
yeah,
got-
yeah.
Would that be comparable to like a Sprague Dolly rat? In
We would
terms of
have to
results?
see, because literature shows that there's differences, for example, between Sprague Dolly rats and Wistar rats. So that Wistar is another strain of rats. So to be honest, we would have to do the experiment, do the diet-induced obesity model with the NIH rats and see if we see the similar results. But
Like in terms of the Sprague Dolly versus Wistar, what have people seen in terms of differences?
I think off the top of my head, not too sure, to be honest, but I think there was the females, they saw differences in sex, I believe. But I honestly forgot about that, yeah.
Other questions?
So Darsh, your group is starting to amass a lot of evidence that suggests that it's really not obesity that causes OA. It's not even fat mass that causes the way that these things are just sort of correlates of the. So when I look at Jackie's data that you showed, Jacqueline Rios, and it was like you put somebody on, you put a rat on somebody, you put a rat on a high fat, high sucrose diet, you give them exercise, and it prevents sort of knee OA. That's very easy to operationalize. Just tell people to start exercising. Your study is cool. It asks a completely different research question. How do you operationalize it? How do you inform an intervention?
In terms of inherent
Yeah.
aerobic capacity? Well,
Yeah.
I would say if you're obese, I guess, you can maybe translate that to having a low inherent capacity. So the results from this, we would have to, if the results show, right, if they're promising, then as I was explaining, the next study, we would aerobically, same as Jacqueline did, we would do this aerobic exercise intervention with the low capacity runner rats and the high capacity runner rats. And if we see that the low capacity runner rats fed the high fat diet plus the aerobic exercise intervention were protected, then I feel like that would be more readily translated.
Say it again.
So if this model works, then in the next study we would take.
Let's assume it works.
Let's assume it works. Yeah, thank you. We're gonna implement this aerobic exercise intervention.
Okay.
All right. So we are gonna have low capacity runner rats on the chow diet with the aerobic exercise, low capacity runner rats on the high fat diet with the aerobic exercise, and then the other ones without the aerobic exercise.
Yeah.
And the hypothesis would be that the low capacity, so here we saw that the low capacity had bad joints, right?
Yeah.
To simplify.
Yeah.
We would expect that the low capacity runner rats on these diets, plus the aerobic exercise intervention, would be protected.
I see. So the low capacity rats in this study,
Mhm.
do you think that their capacity compared to the spine dolly rats that Jacqueline used would be like, these are way more out of shape than the rats she used?
I wouldn't say that. So I think what we noticed in the Sprague Dolly, obviously there's some strain differences, and if I recall their data, the Sprague Dolly rats gained even more body fat and even more body mass. So I wouldn't conclude that the low capacity runner are more out of shape. Well, it would be hard to define that.
Can I add something to your question?
I was hoping you would say you're gonna inject something into somebody and you're gonna turn them into this inherently.
Would you like to be the first?
Oh, yeah, sure.
I think it's a powerful message in this type of inherent capacity. So the most of the population has this sedentarism and lower capacity kind of background. And I think because this rat, they didn't receive any training, training. So that is, I think, is a power message that without training, if your environment factors that can increase your, family's activity in community brings you the idea that exercise protects you. So even without any training, that give us a powerful message for public policies. So that is maybe we need to do something to increase the access, to the population to start to do exercise, and eventually that generation will become protection instead of being sedentary all the time. So I think even without exercise, we are seeing that one population with this big inherent aerobic capacity is prevented. So why not apply to a public policy to see, look, that is something important to add it. It's just not genetic, it's more factor because
Here it's just genetic.
Yeah, but in humans, it's not just genetic. So they started in the 70s comparing twins, and they found that genetically they share 60%
came from genetic, but nowadays, after reviewing the literature, is mostly 30% humans came, the aerobic capacity came from genetic, because there is a lot of factors that are involved. Of course, this rat doesn't represent the human population at all. This high capacity aerobic is too extreme, but the lower one maybe is more close to us.
Okay, hypothetical. You finish your study, you do the exercise training, and you find that the only people that benefited from the exercise, or what you find that low capacity runners combined with exercise does nothing to affect the joint. Okay, nothing. Meaning that it's all due to the inherent what kind of capacity? Aerobic capacity of the rat. Does that change your idea of your public health message?
Darsh, do you have a thought?
Oh, sorry.
No, it was, please.
Because I was.
Yeah, no, keep going.
Okay, all the results in exercise and metabolic changes has been showing that exercise is doing something. Yeah. So I cannot be against or say something against that. We cannot
You
forget
can't
about.
entertain my hypothetical.
Yeah.
I think Adam here has a great point.
Yeah.
I mean,
I was gonna ask if you think this kind of thing could ever evolve into like a prediction model where you took somebody's inherent aerobic capacity to predict potential severity of OA. If, for example, in Brent's hypothetical situation, diet and exercise had no effect.
100%. I think then we could use it and then we could think of other preventive measures for the low capacity runner rats, other than aerobic exercise.
Well, it's an interesting thought, that if you took the low capacity runners and you trained them and brought up their aerobic capacity, then they would be equally bad off than they are now. If you take that strictly at face value, then you would say inherent aerobic capacity is good for you in being protected against musculoskeletal degeneration in the presence of high fat super diet. If you have a low aerobic capacity, you cannot training acquire aerobic capacity does not work. So therefore, then you're stuck with a non-modifiable factor, because you are born with a certain capacity, and if you then train and you elevate that and it doesn't do anything, then it's non-modifiable, and that's it. But some of the results that we have from previous studies, other strains and so on, seem to suggest that aerobic exercise does something. But of course, the question is, in these trajectory rats that we train, when did their aerobic capacity increase? Was 12 weeks enough? And is it the increase in aerobic capacity? Or when you exercise, we know that you release hundreds of different myokines that then flood your system, and might it actually be exercise that is beneficial, and the myokines that you release and the hormone changes associated with that, and the aerobic capacity that you have through endurance training actually really didn't do anything. I mean, that's going to be very interesting to kind of entangle that.
Yeah.
So being there, and the next question is, you haven't really looked carefully yet at the metabolic results.
Not yet, no.
So based on what you have, what are you predicting the metabolic results will show you?
Yeah, I'm predicting that the cytokines and adipokines will be elevated more so in the low capacity runner rats. And this is also based on previous literature that has shown this, but previous literature, they utilized just a high fat diet, and we had a high fat, high surplus diet. But my prediction is that these markers, these cytokines will be elevated. And in terms of lipid profiling, we're gonna.
So in the low capacity runners.
And then I also expect a difference between the diet as well.
Between the diets for
Yes. The low
both
capacity.
For the low capacity.
Yeah, just for the low capacity.
And for the high capacity,
Regardless of the diet, I expect it to be less.
you expect to be less
Yeah.
and not different in the high capacity.
Oh, no, also difference in the diet, sorry.
Also different, also more cytokines.
In the high capacity, high fat.
Low level inflammation.
Yeah. At least based on what we see from the body fat.
That would be interesting because then you would have the difference in metabolic
Mhm.
profile, but
Not
you would
joint
have a
integrating.
change in the joint. That would
No.
be, that would be interesting.
Question?
I think just a comment on what Walter was saying before, I think you were mentioning that if we find nothing in the hypothetical situations where that there's no effect of exercise, then I think Walter said we're left with nothing that can be modified or be an intervention to help. But I think the diet aspect in your study could be a really interesting thing. So you said you had data set to add to the
Yes.
different two different diet groups.
Yes.
And I think if you were to find a difference between the two diet groups, let's say if you're low capacity, we find, exercise does nothing, but then now you have a good motivation to inform the public that the diet that you eat now is, affecting your risk of failure.
That's a great point, Ashna. And to add to that, I didn't mention it in the background, but previous diet-induced obesity studies also looked at fiber supplementation. And then it would be interesting to see whether, okay, if the aerobic exercise intervention had no effect, but we saw from this one that the chow was less worse than the high fat, right, in the low capacity group. What if we also have chow plus the fiber supplementation? Will that, have a protective effect? Because we saw in previous diet-induced obesity studies that fiber did have a protective effect. So.
Right, because a lot of times it's just informing the public of you should be active, but the diet aspect gets lost. Like you said, the North American diet is pretty bad. So if I know I'm low capacity and I should eat less burgers, and that would help me prevent away, that would be a good thing.
Awesome. So let's thank Darsh again.